The United Nations estimates that there are currently more than 50,000 pregnant women in Gaza, with an average of 180 people giving birth every day. With the Gazan healthcare system largely collapsed, many women are unable to access services they need to give birth safely and to care for their babies. Some women are giving birth in temporary shelters, in homes or on the street. Where hospital services are available, some procedures, such as caesarean sections, are being performed without anaesthetic. Health organisations have reported a 300% increase in miscarriages since the start of the conflict because of issues like malnutrition and lack of access to healthcare. A psychological toll of the conflict has also increased the number of stress-induced miscarriages and premature births. And the difficulties continue after women give birth. If the baby has been born in hospital, many are being discharged within a couple of hours, leaving them without physical and mental health aftercare. Food and water shortages are also affecting breastfeeding women who need more calories and water intake to feed their newborns. Let's talk to Tess Ingram, who's a communications specialist at UNICEF. Good to see you, Tess. Welcome to the programme. So I understand that you have just come back from Gaza. Give us a sense of the situation there and what you saw.
I was mostly in Rafah in the south, but I was also visiting Khan Yunis and Deir al-Balah in the middle areas. And the situation is beyond breaking point. I think everything that we describe when we speak to each other and when we see images on the news is true, but absolutely magnified when you're there on the ground. I met dozens of people who all told me different stories of horror and loss and pain, but also love and hope. But the same things kept coming up again and again. And that was really the lack of food and clean water that families have and the real challenges that women, particularly pregnant women, are going through.
Well, pregnant women, of course, and women who've just given birth, more vulnerable, really, than, even at the best of times. What kind of conditions are they facing now?
Well, you can imagine that if you're a pregnant woman, you're trying to keep yourself healthy for the benefit of your future child. And I think that so many of the mums that I spoke to had serious struggles with nutrition. Many of them had children already, and they said that they were really trying to make sure that they had enough food for themselves and their children, but there just wasn't a lot of food to go around, and what they were able to get isn't particularly nutritious. There's maybe bread or some tinned vegetables that are shared among large groups of people. So pregnant women were very concerned about their nutrition, also about their living conditions, their inability to bring their baby home to somewhere safe. Many are living in makeshift shelters on the street, are exposed to the elements. It's really cold in Gaza at the moment. It's the coldest month of the year. And a lot of these babies, I met one actually that was returning to a makeshift shelter hours after being born with no clothes.
And we know that the medical system in Gaza has largely collapsed. We said in our introduction there that some pregnant women are having caesareans without anaesthetic. What does this collapse of the health system mean for pregnant women and babies?
Yeah, it's very serious. So there's barely any functioning maternity hospitals left. I visited the Emirati Maternity Hospital in Rafah, which is shouldering the burden of now, as you said, the 1.5 million people who are living in and around Rafah. And the number of women seeking care there was enormous compared to the capacity that the staff have, because there are fewer staff working with very limited resources. And so when women come to the hospital, the care that they're given is not what the hospital is usually able to provide. And the nurses that I spoke to were kind of lamenting that fact, that they used to be able to provide very good care for these women. But now, as you said, we're having to do operations without the proper medicine. We're having to put 2 women in one bed and discharging women within, 3 hours was the example that they gave me of giving birth. So the conditions are very serious, not just for when women are giving birth in the hospital, but in the lead up as well. I spoke to one woman, her name's Mashael, and she told me about how when her husband was buried underneath the rubble, she managed to survive, her husband managed to survive that attack on their home, but the baby inside her stopped moving, and she hadn't been able to get any sort of scan because care during pregnancy is basically non-existent. She was sure that the baby had died, and it had been a month since that attack on her home, and she was still waiting to have some sort of medical assessment.
And there have been, very sadly, a 300% rise in the number of miscarriages taking place in women in Gaza. Are there psychological effects too from the uncertainty of being pregnant during a conflict, and perhaps what your baby is going to be born into?
Yeah, absolutely. I think, you know, we can only imagine what that would be like. But for the women that I spoke to in the Gaza Strip, that was their reality of worrying about whether their pregnancy would make it through to birth, and then what the prospects were for that baby. You know, so many of the pregnancies, according to medical professionals that I spoke to, were complicated because of the conditions in the war. Many of the babies were being born not completely healthy, and so the mums were aware of that and concerned about that moment of birth and what might happen, but also then about returning a baby to a shelter where they couldn't guarantee the safety of that child for the foreseeable future. So it definitely has an impact on the mental health of these women, and UNICEF is there trying to respond as best we can by, you know, providing medical care, medical kits, obstetric kits that have things like anaesthetic in them, midwifery kits with PPE for nurses to help try and control infections. We're also providing some psychosocial and mental health care, but the needs are so enormous that we really need a ceasefire to be able to meet those needs.
Tess, great to talk to you today. Thank you for joining us. That's Tess Ingram from UNICEF.